Hello everyone, my name is Carlos. I'm a research associate at the University of Bristol, part of the Health Economics group at RWest, and I'm here to talk about evaluation purposes. This is the final pre-recorded session of the day about evaluation purpose before the live discussion and question and answers. As you have already seen in this session, choices are constantly being made about how resources in the NHS are used, and that, as stated in the NHS Constitution, the NHS is committed to providing best value for taxpayers' money. At a national level, the work of NICE has given a high profile to the importance of research to generate evidence on the clinical effectiveness and cost-effectiveness of new technologies and treatments. However, NICE guidance only covers a small proportion of clinical activity, and even when guidance is available, its use to influence clinical practice is variable. So at the local level of clinical commission groups or the new integrated care system, there is a need for decision makers to actively support healthcare providers to improve services and demonstrate that they are using resources to deliver best value. Important insight into how commissioners actually use information in their decision making is available from research undertaken by Leslie White and colleagues here at the University of Bristol. The qualitative study of how commissioners access and use information and academic research in real-life decision-making found that local information often trumped national evidence or academic research. Moreover, commissioners repeatedly called for local evaluations of services and innovations in order to, as this equation shows, to say yes and it is delivering what we expected, or isn't it? So what do we mean by local evaluation? The term evaluation is regularly used and can appear interchangeable with the terms audit, service evaluation, and research. Audits measure an aspect of practice against a recognized standard. If a certain practice meets the standard, good. If not, action might be taken to improve it. Audits are widely used at local and national levels. Service evaluation aims to appraise how well a service is meeting its objectives and determine what standard, however defined, is being achieved. Service evaluation are often specific to the context of the service being evaluated and do not seek to produce generalizable findings. The strength of the evidence generated by a service evaluation will depend on a range of factors, including the analysis method used. You will see these in further sessions. They can, however, be powerful in determining which parts of the service are effective and which parts require improvement, providing an evidence base for future service improvement plans. A service evaluation do not divine new knowledge. In contrast to service evaluation, research studies attempt to address a clearly defined question in order to divine new generalizable knowledge, which is transferable beyond the scope of the study. Typically, the purpose will be to determine whether a new existing treatment or intervention is clinically and/or economically better than usual care or an alternative treatment. This table summarizes the difference between service evaluation, research, and audit. As I have described, the overall aim between these three activities are different. This also influences the study design, strictly linked with this overall aim. Tim will talk about the benefits of randomization or allocation patients to groups in randomized controlled trial, RCTs, in the next session. There is a useful online decision-making tool to know if a project is research, and it is easier than you can think that your project is considered research. For instance, any study involving the administration of questionnaire for quantitative analysis, or using mixed methods, quantitative and qualitative methodology, is considered research. Even though the goal was only to judge the quality of the current service, what we have seen is called service evaluation. Unlike research, service evaluation or audit does not require a specific NHS Health Research Authority approval from a research ethics committee, but ethical principles must still be adhered to for the protection of patients, meaning consent, anonymity, and data protection and privacy. There are three key types of service evaluation. Formative evaluation aims to generate early or interim findings that are explicitly used to improve how a service, innovation, or project can be developed whilst it's still being implemented. Process evaluation reviews the implementation of a project, evaluating how activities were executed and whether this was and is intended in the project plan. And impact evaluation, which focuses on project outcomes, whether a project or service is meeting its intended objectives. This sounds straightforward, but in practice is associated with a range of challenges. The value of the evaluation will depend on the availability of data relating to outcomes, the methods used to determine what impact can be attributed to the project, and also the appropriateness of the objectives against which change is assessed. Evaluation may therefore be summative, occurring at the end of a project or after a new service has been designed and implemented, or formative, occurring at one or more stages during the implementation of a project. Also, it's important to note that evaluation can use mixed methods approach, collecting and analyzing both quantitative and qualitative data. The methodology used depends on a range of factors, including the aims of the evaluation and the funding available. Evaluation can play a useful role across the life cycle of a service in order to support its aims, as evaluation might answer important questions during the planning and setup, during the implementation and development, and after implementation is complete. As Gareth has already outlined it, economic evaluation has an important role to play in going beyond assessment of outcomes in terms of measure of effectiveness, but to explicitly account for the associated impact on resource use and estimate the cost effectiveness of interventions. This is illustrated very well by the Medical Research Council's framework for the development and evaluation of complex interventions in health, which underlines the importance of economic evaluation. It should be included if ought possible, and this will make the result more useful for decision makers. You can see this in the figure of key elements of the development and evaluation process. More typically, if economic evaluation is undertaken, it will have a more limited purpose, focusing on measures of efficiency by seeking to assess whether a change in practice has led to cost savings. Commissioners frequently introduce new policies with the aim of the widespread adoption of a new treatment practice or techniques in a short time period. Evaluation is often appropriate, but if undertaken at all, it can be difficult to implement study designs that are fit for purpose. One of the challenges is that commissioners and other policymakers can be reluctant to wait until evaluation evidence is available before changing working practices. Once some localities are seen to innovate, others might adopt the change without consideration of the limited available evidence. Similarly, it might be that an appropriate evaluation design is viewed as too expensive to implement, and that in turn can limit access to necessary expertise. We're going to look at a couple of evaluation examples in session 5 tomorrow, which illustrate some of these issues. But for now, we can finish by note that it can be useful to distinguish situations where there is an already well-established evidence base for a particular innovation in practice, and those where there is no established evidence base and the evaluation needs to therefore demonstrate treatment cost effectiveness. In conclusion, different types of evaluation have different purposes. Service evaluation is not the same as audit and not the same as research. Evaluation is needed across the life cycle of a program or service to support its aims. Economic evaluation to assess cost effectiveness is recognized as important, but can be challenging to undertake. It can be useful to distinguish circumstances where there is an already well-established evidence base for a particular innovation in practice and where there is no established evidence base. We will explore this further in some case studies in sessions 5 tomorrow. I have added some reference here that can be useful and can be used in this session. Thank you so much for listening, and I will see you tomorrow in session 5 for a case study.